All right, how's it going, my fellow engineers and my fellow philosophers? And if you're thinking to yourself, I am not a professional engineer and I am not a philosopher, that's okay. You actually are by virtue of the fact that you're watching and learning from this video. So, welcome back, everybody, to Engineering Major Philosophy Minor. Of course, EMPM is the channel where you can get a working aerospace engineer's opinions on topics pertaining to engineering, philosophy, politics, and social issues. So the news cycle has been evolving extremely rapidly since my last video. Of course, in my last video, we sent a nice little letter to President Trump wishing him well in his coronavirus recovery, and he in fact did completely recover from coronavirus. In fact, his doctors are reporting now that he is no longer able to transmit the virus, and then for some reason we still didn't have a debate between him and Joe Biden, and we had these crazy town halls, and then some people from Joe Biden's camp tested positive for coronavirus, and then all this stuff is coming out about Hunter Biden, and there's just so much crazy stuff going on. And so the topic of this video may be a little bit of late news, I guess, but I still think that it's an interesting topic to cover, and we're going to talk about some engineering concepts in this video as well, and that is the topic of mask wearing and studies that have been cited in order to suggest that mask wearing is kind of this end-all be-all mitigation plan for coronavirus, and if we would just wear masks, then everything would go away and be wonderful. In this video, I have a clip here from CNN. I'm going to kind of use that to introduce the topic a little bit. We'll react a little bit to the CNN video. Of course, the CNN clip is 6 minutes long. We're only going to watch maybe hopefully 30 seconds to a minute of it. Not too much of the video, just a little bit for everybody to get an idea of what's going on. And then we're going to talk about an engineering concept called experiment design. And with that, then we're going to look at the studies that have been cited to produce some of the bullet points that CNN has produced. So let's go ahead and check out this clip really fast here.
We have pointed out before how millions of Americans are relying on Fox News to get their coronavirus information, or misinformation, I should say. And that includes the president. The biggest names on that network have helped politicize this pandemic, making misleading or false claims about everything from masks to social distancing to...
So I just want to pause there for a minute because, of course, here, there is the accusation put out there that, first off, that everybody goes to Fox News to get their coronavirus information. Of course, I think that if you talk to most people, they would go to their doctor or medical healthcare professional to get most of their coronavirus information. And also important to point out is the accusation is being thrown against Fox News, that is Fox News that is politicizing the whole coronavirus thing. Of course, this CNN news host decided to conveniently put in there that President Trump is the one who has actually been peddling misinformation or whatever, which is sort of a surprise to me because if I recall correctly, CNN and other left-leaning media networks have been saying for months now that everything bad that has ever happened with regards to coronavirus is entirely Trump's fault, that if Trump just had a plan that was similar to the Democrats' plan, that everything would be hunky-dory and okay. We have indeed heard from these networks that people who are conservative and don't want to wear masks are responsible for deaths. We've heard that Trump is directly responsible for deaths associated with coronavirus. The left media has been calling conservatives and conservative news networks completely anti-science, even though conservative news networks have been putting out a lot of the same exact information. So I think it's pretty fair to say that actually the left is mostly responsible for politicizing things, but let's just continue with this.
Treatments for the virus. And if you only watched Fox News, you might think that hydroxychloroquine is to coronavirus what Tylenol is to a headache, or that gathering in large crowds without masks indoors is safe, or that Democrats want schools and businesses to be closed forever.
Well, Democrats do want schools and businesses to be closed forever. Notice how she says gathering without masks indoors is safe. Well, most red states have mask mandates in almost all businesses where you must gather. And of course, people are going to say, well, the Trump rallies were indoors and no one's wearing a mask. Well, people are actually required to wear a mask when they go into those. Of course, once they get inside, it's up to them to decide if they want to wear the mask or not. And it's up to other people to decide if they want to be around people who are not wearing masks. And this is all kind of consensual decisions between willing participants to be around people with or without masks, accepting the risks. In a second here, we're going to see a Fox News clip that she's referring to kind of give hopefully a concrete example of what she's talking about.
And why would you think that?
We have decades of medical science, randomized controlled studies that show for respiratory viruses, masks do nothing.
Just to be a little bit even-handed with this video, that particular clip from Fox News is a little bit interesting. Now, I'm not sure what studies the particular person on Fox News was citing. I'm sure that they have a list of resources for where they got that. Of course, the clip was cut conveniently to a point where you may not be able to get the full context of the statement or get a clarification on the statement. Let's just pretend that, that's the statement that was made and that's the context. It is a little bit disingenuous to say that masks do absolutely nothing. We're going to see in a second that they do something, but we're also going to see in a second that what CNN seems to be implying that they do, or at least the benefit of what they do, is a little bit overblown relative to the actual studies that they're citing. So let's check this out.
That is just false. It's nonsense and it's dangerous. It's like telling people go ahead and smoke. It's actually healthy for you. Researchers at
So that right there is a pretty political statement as well. I'll just say it's like telling people to go smoke and that's healthy for you. Okay, well, there has been like a long history of documented experimentation and clinical studies and all this stuff that smoking is directly responsible for various lung diseases or the progression of lung diseases. That being said, another important thing to point out, which we're going to see in a second too, is that a lot of these studies focused on mask wearing have proviso statements in there suggesting that masks are good at blocking respiratory droplets from somebody who is infected, but may not necessarily be effective for somebody who's wearing a mask and inhaling potential respiratory droplets.
Brigham Young University have compiled and read more than 115 scientific studies on the coronavirus, and there is consensus, broad consensus, that masks work. Here
Okay, so there's broad consensus that masks work. Well, work at doing what? That's the important question that I want to kind of address in this video. So let's just listen
some
for a
key
second.
points. Cloth masks can stop 90% or more of droplets carrying the virus from being dispersed.
The question then becomes, well, how many viruses does it take to infect? Because what about that 10% that makes it through? If that's enough to infect, then we're not actually looking at transmission, right? Like we're just looking at whether or not droplets are blocked. But transmission can still occur with that 10%. If transmission can still occur with that 10% they get through, then how do we know that masks are really as effective at reducing transmission? Now, to take this back to the Fox News guy who was talking, he says masks do absolutely nothing. Well, what we're going to see is that these studies block droplets, right? But what if the context of doing absolutely nothing, what he really meant is they do nothing at stopping the pervasive spread of a virus through a population, right? Which we're going to see when we look at the BYU study and go into the very specific actual scientific literature in this. The scientific literature actually doesn't say anything about transmission, and there's an important reason for that, which we'll get to in a second.
In countries where public masking was common practice before the pandemic, COVID-19 had an initial daily growth rate of 10% versus 18% in places where people did not regularly wear masks.
Here now they're trying to give some qualifying statistics to this. All right, well, masks stop 90% of droplets, and then, hey, look, in countries where public masking is common, they only had a growth rate of 10% versus where public masking was uncommon, only a growth rate of 18%. Well, that's actually not that big of a difference, right? I mean, if you thought that preventing 90% of droplets meant a 90% reduction in spread, basically countries where public masking was uncommon should have that same ratio, a 90% higher growth rate of the virus, right? But here they're presenting 10 and 18%. That's actually not a huge percentage. Now, you might say to me, well, Alex, we're talking about exponential and logarithmic curves and stuff like that. And when you start getting into that relationship, 18% can make like an overall, like a bigger magnitude difference in number of cases or number of deaths over time. And you're absolutely right about that. But the question is spread out over what time period? Ultimately, the whole purpose of slowing the spread wasn't to completely eliminate the virus from spreading. It was to slow it down so that our healthcare system could catch up, which, by the way, our healthcare system apparently was already completely adequate. I mean, it was never overrun. And especially in New York, which is a place where the virus was basically ran rampant through the population completely. I mean, that's kind of pretty evident in their data. But that said, the overall total number of cases between this 10% and 18% daily growth rate might not actually be any different. And then, of course, just quickly, the last bullet, they say projections show that more than 400,000 people will die from COVID by January. Well, this is just a projection. We have seen with many aspects of science lately that these projections can often be very flawed, very wrong, and they just can't possibly take into account all the different variables of the problem. All right, guys, so what I did here was I actually looked up the BYU article that they're referencing, which is right here. It says masks prevent infected people from spreading the virus to others by trapping the respiratory droplets, tiny moisture particles that are produced when we cough, speak, and breathe. They give a list of references. Cloth masks can stop 90% or more of the dispersal of droplets carrying the virus. There is some evidence that cloth masks also protect the wearer from infection, though this is less certain. Okay, so this is important right here because CNN seems to think that if you just stop 90% of these droplets, that means that you've prevented 90% of the transmission. However, within their own reference, they kind of give up the game here a little bit, saying that there is only some evidence that masks also protect the wearer from infection, though this is less certain. So what does that mean? If you have somebody who is wearing a mask who is infected with the virus, they cough or sneeze, 10% of it gets through, and you are wearing a mask around them, there's no guarantee that mask that you're wearing prevents you from getting the virus. This is really important because the case that CNN is trying to make is that there's a dramatic decrease in transmission from mask wearing. I don't even really care about whether or not it blocks respiratory droplets, right? Like what I want to know at the end of the day is what is the transmission? And this is a good segue into kind of the engineering related topic that I wanted to discuss in this video. In engineering, we do a lot of experiments, we do a lot of testing, especially in aerospace, especially because the safety stakes are really high. We do materials testing, we do manufacturing testing, we do operational testing, we do environmental testing, et cetera, et cetera. A very, very important premise of all this testing is that we actually design an experiment that shows us a result that we're interested in seeing, right? So just to give a stupid example, let's say that I wanted to test how much I would have to bend this pencil in half in order to break it, right? Well, if I was to design an experiment around this, what would I want? What would I need to measure? So obviously I would need some kind of indication of whether or not the pencil broke. Now that could be a visual indication of when it snaps, or that could be a measurement somewhere along the pencil that shows when there's degradation of material, although that's a little bit more difficult to assess. And then you might also want to measure the actual force that is getting applied to the pencil so that you could make a direct comparison. You could say, all right, I see the force going up, and then at the same time, I see the pencil break, and clearly it broke at that force level, right? Like that would be a very straightforward measurement. Now, sometimes maybe we can't measure the force, or you can't measure exactly when there's material degradation, so you have to do an indirect measurement. So one way I might do an indirect measurement is I'm not measuring the force, but maybe I'm measuring, the local deformation of the pencil over time. and then I see at what deformation it breaks. Now, there's a very important thing that happens when you do an indirect measurement this way, which is that you need a mathematical relationship between what you have measured indirectly and what is the actual direct thing that you're trying to calibrate, let's say. So fortunately, in structural analysis and design, there's a direct relationship between displacement and strength and things like that. It's a well-established mathematical relationship, right? Well, in these studies, what we're going to see is their experiment is designed not to measure transmission, but to measure droplet count reduction. Now, droplet count reduction is an indirect measurement of transmission, and the assumption is that if you block enough respiratory droplets, you've reduced the transmission rate effectively. But there's an important thing here. Just like how I was talking about the pencil, where you need a relationship between displacement and the force and the strength of the material, there's a mathematical relationship there. There is no established mathematical relationship between reduced droplet count and transmission rates. There isn't. And we'll look at the study in a second. They never mention transmission once. So let's talk about now what the experiment design would have to be in a situation like this if you wanted to understand what the efficacy is of masks in reducing transmission, right? Well, the most direct measurement that you could possibly do is that you get 1,000 people who are not infected with the virus, you put them in a town. Then you get another 1,000 people, you put them in a different town, completely isolated from one another. In one of the towns, everybody wears masks constantly, and in the experiment design, there would have to be specific protocol as to how to wear the mask, when you're allowed to take the mask off, etc., right? And then in the other town, no one's wearing masks, so that you establish a baseline control. Then you introduce an individual who is infected. And then you study the two populations and see how the infection spreads, where the only mitigation method is mask wearing. Because remember, when you do these experiments, you need to take away variables, right? So before I get too deep into this, why don't we just go ahead and jump over to the actual study. So there's a ton of different references, but the reference that I'm actually going to look at is the reference that produces these plots right here. This is where they show droplet count, and then as a function of basically which mask is being utilized. So they've got, fleece, no mask, a bandana, all the way up to a fitted N95 and a surgical mask, etc. The relative droplet count here is measured on a scale from 0 to 1, where 1 means the most amount of droplets got through, and 0 means that no droplets got through. The study that I'm going to look at, low-cost measurement of face mask efficacy for filtering expelled droplets during speech. Now, let's just look at the title of the article for a second, because, this is where BYU is getting their 90% of droplets prevented, right? This is where CNN is getting their 90% of droplets reduced. Does it say anywhere here anything about having to do with transmission? No. They're talking about low-cost measurement of face mask efficacy. So right away, I can already see just from the title of the article, what they're trying to do is develop a method that they can use to assess the efficacy of different kinds of face masks easily and quickly. Now, efficacy of what? Is it efficacy of transmission? Risk of transmission? No, it's efficacy of filtering expelled droplets, right? So it's very important when you are kind of trying to go through information and scientific information, like with regards to things that are informing public policy, it's very important that you know exactly what is being talked about, exactly what the experiment is. So I can see right away that this experiment has nothing to do with transmission, yet CNN and even the BYU article to a certain degree are making this second step forward for which there's no real relationship established yet, which is that because you've prevented 90% of droplets, you therefore prevent spread just from that reducing that droplet count alone. Now, I was talking a second ago about how we need to eliminate variables. So I'm going to jump down to the results section and just read a little bit here. We tested 14 commonly available masks or mask alternatives, one patch of mask material, and a professionally fitted N95. For reference, we recorded control trials where the speaker wore no protective mask or covering. Each test was performed with the same protocol, so that's eliminating variables. The camera was used to record a video of approximately 40 seconds, so that's their time period. Only 40 seconds, okay? So this isn't necessarily the study of a full-blown conversation between two people, right? Record a video approximately 40 seconds length to record droplets emitted while speaking. The first 10 seconds of the video serve as a baseline. Okay, fair enough. In the next 10 seconds, the mask wearer repeated the sentence, "Stay healthy, people," 5 times, after which the camera kept recording for an additional 20 seconds. For each mask and for the control trial, this protocol was repeated 10 times. We used a computer algorithm to count the number of particles within each video. Okay, so one thing that they don't mention here is the variability of distance away, which they do mention somewhere else in the article. But keep in mind that in the actual real world, right, people are fidgeting with their masks. They maybe talk into their masks. Maybe they are like, oh my gosh, I can't believe that happened. And then they get particles on their hands. They shake hands with people. Maybe they're 6 feet away. Maybe they're not 6 feet away. There's not wind blowing, you know, so particles can get blown directly into somebody's face or something like that from somebody else. So you can see right away that there's all these other avenues for transmission that this study doesn't address. Now, that's not to say that this is bad science or this is a bad study. This is actually a really nice study. This is what you want to do with an experiment. You want to eliminate variables to measure what you're trying to measure. The important thing, though, that I want to drive home is that this is not measuring transmission. This is only measuring droplet count. Without having to read through all this, let's look at their experiment design. So here's the experiment design right here. They've got a hole right here for speaking. So the person comes up here with their face. Here's the camera here, and they've got this spectral beam right here which illuminates all the particles. So all the particles are seen by this camera back here, and then they have a computer algorithm that can identify where there's different areas of spectral, there's different areas of light basically, and can assess on a scale of 0 to 1 with fractions in between how effective or how many particles are observed, right? Now, the person speaking in here also says a very specific phrase. Now, if you go in to look at kind of speech pathology and stuff like that, and what sounds tend to, eliminate or emanate the most particles, you'll see that P sounds typically do, which is good that they put a P sound in the actual phrase that people are saying. But you can imagine a situation where they may not have had a P sound or something like that, and that would probably also impact the results, Also, this doesn't talk about coughing. It doesn't talk about sneezing. It doesn't talk about when people are yelling at each other. It doesn't talk about relative volume. So there's all these different variables that are taken out of this study. Yet CNN and BYU want to say, well, here's this conclusive evidence that masks are effective at reducing transmission. Well, no. They're only 90% effective at reducing droplet count. There's no relationship between that and transmission. Now, if CNN didn't want to be political, didn't want to be biased, maybe they'd mention that, but they don't. So here's a view of all the masks they tested. And, I want to say, this is a very comprehensive study. Now, what do you see most people wearing around? You see them wearing the bandana, you see them wearing one of these, neck breather things. Very rarely do you see someone wearing a fitted N95 mask. There's all these different types. Okay, fair enough. Now, here they get to the graph that they actually presented in the BYU article. Which masks of these, and actually look at some of the error bars on some of these, right? This is a broad range right here for some of these. So which masks actually reduce by 90% within their full error bars. So we've got 0.2 right here, and 90% reduction would be 0.1, which is right here. So let's just kind of draw a line across here. So what is this line saying? Basically, these masks right here, these are the masks that effectively reduce droplet count by 90% when speaking a specific phrase using the mask in the correct specific way at a distance established by where the camera is relative to the speaker, which in the previous view looks like it's relatively close, right? Look at all these other masks that people use. In practice, people are mandated to wear a face covering, right? A cloth face covering at businesses. That could be any one of these masks right here. And look, cotton 1, cotton 2, I mean, this is only a 60% reduction in droplets. Look at the bandana. The bandana is basically ineffective. I mean, if you're lucky and you're wearing it perfectly, you get down to 80%. But look at the error bars there. Look at knitted. Look at fleece, you know. So guys, the purpose of this video is not to bash on any of the science. A lot of this is actually really good science. It's good information to know. And it's helpful towards, you know, figuring out kind of what, it's helpful in supplementing what public policy decision is to be made. But if, you know, the question is, what conclusions do you actually draw from this study? So the conclusion that I draw is, well, you're not actually measuring transmission. Okay? To say that masks do absolutely nothing isn't true, right? As the person in the Fox said. They do something. They block some percentage of respiratory droplets, right? But then the question becomes, does that really reduce transmission? Well, we don't know, because there needs to be another study done that establishes this relationship between how many respiratory particles are dropped and what the transmission rate is. And to do that study, as we talked about a little bit earlier, basically requires you to have people accept the fact that they might get infected by the virus in a closed off community where the only means of transmission is mask wearing, right? Which means that they can't touch other stuff, and all these other pathways of transmission, those variables need to be eliminated. And what it comes down to is it's more trouble than it's worth. Conveniently though, we actually have coronavirus data. So we've kind of established that actually getting a reasonable measurement of how effective masks are at preventing actual transmission of the virus is probably untenable, right? But what we can do is we can look at some real world data of a place where masking is very common, is encouraged, social distancing is encouraged, and all these mitigation plans are put in place to try and slow or stop the spread of the virus, right? And the perfect example of that is California. Now, what's beautiful about the response in California is that you can very clearly see what the spread looks like with all the different variables mixed in there. This data includes people not wearing masks effectively, people taking their masks off when they're at home around loved ones, people going out to eat, lockdowns, protests, you know, and well, actually what's nice about California is there haven't been any Trump rallies out here, right? So you can't make this claim that, oh, well, you know, the Trump rally where no one's wearing the mask is why there's a super spreader event, you know? Like, when you can't design an experiment that perfectly captures what you're interested in this case transmission, then you can actually look at real world data that has evolved over time and make assessments there. Now, I invite you to look at this. So this is, you know, every county in California. We've looked at this data a million times. I just updated this, I think, yesterday or 2 days ago. When you're looking at this data, what you see is that the virus spread, right? You know, it seems to have reached an inflection point. It seems to be going up linearly now. Some places it's a lot more, you know, total case count has seemed to kind of level off a little bit more reasonably. But keep in mind, guys, we've been socially distancing and mask wearing and locking down and doing everything we possibly could for the entire data set that's represented on this curve. So for all intents and purposes, this is about the best you can ever do with relatively extreme public policy, right? What would this curve look like if we had never done lockdowns, if we had never worn masks, we had never done anything? Well, the answer is you're never going to know, right? All you know is that hopefully we're getting to a point where most people have had it already. But still, guys, this is with every single possible best case scenario mitigation plan that we could have. I mean, and that's the other issue. We've all been wearing masks the whole time. So why can't businesses reopen? If you really believe that masks in and of themselves, which CNN seems to believe, same with every other, left-leaning media outlet, same with every other Democrat, if you really believe that masks just in and of themselves are just the end-all be-all to slowing the spread, well, why can't we just open up all the businesses now? Why does the climbing gym have to check in every 2 weeks to make sure they can stay open? Why do they have to be limited to 10% capacity? We're all wearing masks when we're in the gym, right? CNN comes in with their own interjection. Cloth masks can stop 90% more of droplets carrying the virus from being dispersed. And they use this as a suggestion to say, well, science says, masks are effective at reducing the spread. Well, hang on a second. We just looked at the study. We just looked at the experiment design, and we saw that none of it talks about the relationship between reduction in droplets and reduction in transmission. Is there a relationship there? Probably. There probably is, right? But no one knows what that relationship is. We looked at the real world data in California. Everyone's been masking, social distancing, locking down, limiting capacity, not living their lives to as normal, right? And we see that the spread happened anyway. There's no way for us to know what that curve would look like if we didn't do any of it. I suspect it probably would have looked something like New York. So if New York got through all that already, then why do they need to follow all these crazy precautions, right? And then in CNN's own thing, they give up the game, right? They say, well, the only difference between masking is common and uncommon is 8%. Well, that's not 90%, right? 8%. So what that daily growth rate effectively means is, it maybe took a little bit longer for all the same people who are going to get infected to get it, right? That's the only difference with the daily growth rate, right? Notice this doesn't say number of overall infections, number of overall deaths, et cetera, et cetera. And then, of course, then they just throw in this scare tactic. Projections show that we're going to double the number of deaths, basically, in the next 3 months. For CNN to come out there and pretentiously state that, or at least pretentiously imply that, they understand all the science and, this is the end all be all, it's just masks. And, why won't the Republicans wear masks? And Trump is setting a horrible example and he's responsible for death and he hasn't taken the virus seriously. And, Trump got the coronavirus and survived it, but he caused a super spreader event with his crazy rallies, this and that. And, the race riots that we had where everybody was either not wearing masks or just wearing crummy bandanas, which we show in our very own study weren't effective, that's totally fine. But, Americans can't support the president by going to a Trump rally, which, by the way, at most of them, most people are wearing masks. I just watched one the other night where everyone in the background is wearing a mask except for maybe like one or two people. Of course, now someone in Joe Biden and Kamala's campaign, they tested positive for coronavirus. So there was like one headline about that. And then it just disappeared in the mainstream media, right? When Trump got coronavirus, oh my God, they were showing like images of the RNC, of like where different people were sitting in the RNC. And there were all these outlandish articles about this was a super spreader event and, everyone's going to die. And like, can you believe that like Trump is so nonchalant about this? And oh my God, he walked up to the White House and was 50 feet away from everybody and took off his mask when he was still potentially contagious. And just article and headline and article and headline complaining and berating conservatives and pretending that conservatives are anti-science and suggesting that, we don't care about the lives of others and we're responsible for mass death and, all this blah, 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 blah. And then CNN has the nerve to say that, well, it's actually Fox News that's politicized everything. I mean, this is gaslighting to like an extreme level. So I have been going on for an extremely long time about this, but here's what I want you guys to take away. when you're thinking about scientific studies, keep in mind the engineering principle of experiment design. Read the studies. Think about what the experiment actually measures. Think about what the relationship that they're trying to establish is. And then obviously put that relationship into context with the things that you are seeing on the news. And the reason this is important is because, this is the kind of research and thought process that you want to go to when you yourself are thinking about what public policy, what philosophy, what values that you yourself want to ascribe to, what you want to do in your own life to keep yourself safe and eliminate as much risk as possible in your day-to-day life. So anyway, guys, stay safe out there. I hope you guys enjoyed this video. Leave comments below if you guys decided to look at one of the other references in the BYU study and have a contrasting opinion from me, or say, hey, Alex, actually this study shows the relationship between transmission and respiratory droplets and blah, blah, blah. Hey, leave it in the comments below. I'll happily look at it. Happy Sunday, guys. If you went to church, good on you. Have a good one, guys. All right, later.